everyone, and welcome to the second Feel Good Suffolk webinar. My name is Chris Pyburn. I'm Head of Digital and Communication with the Public Health team at Suffolk County Council. This is the second of what will be a regular monthly webinar. If you haven't seen the first one in December, please contact us, we can share that with you. The idea with the webinars is we bring you a regular update about all of the latest news and developments across Feel Good Suffolk. This one will be no exception. We're trying to bring a different range of presenters and perspectives as well, so there's a bit of variation each month. And crucially, we're really keen to invite your questions so that we can answer them each month. And at the end of this webinar, there'll be a reminder of how you ask your question and how you send it in. But the official deadline this coming month for the February webinar will be the 21st of February. So that's the deadline to get your questions in. But please send yours in and encourage your colleagues to do the same. So I'm going to stop talking in a moment, and we're going to hear shortly from Gemma Levi, and then there'll be updates, operational updates from our colleagues Matt Stevens and Amy Marr, and then there's going to be a bit of an overview of the role of a Feel Good Suffolk advisor as well. Harry's going to talk a bit about his role, what he does, and how he supports people with all the key elements of the Feel Good Suffolk service. So that's the content for this month. And again, if you have any suggestions for future content, please let us know. So I'd like to hand over to Gemma next. Gemma Levi is going to introduce the next section.
Hi everyone, and thank you, Chris, for the introduction. So my name is Gemma Levi. I'm a senior manager here in Public Health and Communities at Suffolk County Council. I'm really pleased to continue to share our developments on the Feel Good Suffolk service with you, and we continue to keep progressing and moving forward with the way we develop the service, working with our colleagues across the system. If you haven't seen the first webinar, then just a quick recap. Our Feel Good Suffolk service is our new approach to healthy lifestyle behaviour services across Suffolk. And we are working, as in Suffolk County Council, are working with our district and borough colleagues to deliver a healthy behaviour service for you all. The healthy lifestyle service, known as Feel Good Suffolk, will cover adult weight, smoking and physical inactivity, using our extensive links into our communities via our district and borough colleagues to support people that would like help with any of those healthy behaviours closer to home to them. We're looking forward to continue to developing and rolling out that service, working more and more closely with our voluntary sector and our health colleagues as we move forward. And we'll keep you updated on how those discussions and developments progress over the coming months. If you haven't been to our website, please take a look, feelgoodsuffolk.co.uk, where there's loads of wonderful information around how you can help yourself to address your healthy behaviour or support someone to address their healthy behaviour. You can also make referrals through our website, and where people can then be taken through to see their Feel Good Suffolk advisor. There will be a professionals page on that site as well for any of you who would like further information or in-depth information around those particular healthy behaviours. Our website is supported by a wonderful case management system so that we can see our collective input into the healthy behaviours service from across all our system partners. And we'll continue to develop this and bring you updates on those developments over the coming months. We are keen to ensure that our website and our service continues to meet the needs of our Suffolk community, and through that we're undertaking a lot of user testing both on our website and through our service. So if you're interested in taking part in any user testing around our website, please do let us know and contact us on the email address that will be provided at the end of this session. If you have any questions about how to make a referral, what developments are coming up, then again, please email us and we'll continue to update you either through these webinars or through direct contact, should that be required. We know that the work that we've been undertaking here in Suffolk on the Feel Good Suffolk service is really innovative, it's new, and that we can only have done this because of our working relationships with system partners across Suffolk and that long-standing relationship that we've had working in partnership on a number of projects in the past. This has built a really good bedrock for us for helping to deliver the Feel Good Suffolk service across our system partners. With that in mind, we've been supporting colleagues across other parts of the country who are also thinking of delivering services in the same way by sharing our learning, our information and our products with them to help develop this way of working further across like-minded partners and organisations. Thank you for listening. If there's anything that we can help with or any questions you have, as we say, please contact us through the email provided at the end of this set, and please do go and have a look at our website, feelgoodsuffolk.co.uk. Thank you.
Hi everyone, and welcome to our operational update for Feel Good Suffolk for January. My name is Matt Stevens. I'm the Senior Health, Wellbeing and Leisure Officer based at East Suffolk Council, and I'm a project manager working across the Feel Good Suffolk project, and I'm joined by my colleague Amy.
Hi, so my name's Amy. I'm the Health, Wellbeing and Leisure Project Officer, again working alongside Matt at East Suffolk Council and helping to facilitate the Feel Good Suffolk project.
So we're going to take you through a quick operational update, going through our current numbers into our services and some operational updates as well, including some current developments. So as an overview, our current referral figures, we're up to a total of 2,407 referrals across Suffolk. In terms of numbers, October is still our highest month of referrals. However, January so far, up to the 14th of January, we've seen 356 referrals. So we'd expect January to be close to the October numbers and certainly busier than we saw in November and December. In terms of the split between our three service areas, adult weight management is by far the most popular service for referral, with 61.4% of overall referrals. We have seen smoking cessation referrals start to increase, and that now makes up just over 25% of our total referrals. And physical activity remains the lowest service area for referrals, and that's up to 12% currently. When we see the split across districts, this has remained pretty consistent since October. East Suffolk has around 34% of the split. From there, we then have Baber and Mid Suffolk with 23.9%, West and Ipswich with 15% and then 18%, and there is a small amount there that are still to be filtered into their area. And then finally, on the graph on the right-hand side, you can see a bit of a split there across each of the months, and you can see that's remained pretty consistent as we moved across the first 4 months.
So as Matt said, we've received just over 2,000 referrals so far. You can kind of have a look at the breakdown of what types of referrals have been put through to Feel Good Suffolk so far. So you can see just over 1,000 have been self-referrals. So those are referrals that have been made via our website. Some of those self-referrals have also been made by GP practices, for example, or health professionals, and that makes up just over 300. And then you've also got a further just over 1,000 professional referrals that have been received via the clinical systems, DXS and System 1. And then you can see a breakdown of the types of interventions that our advisors have been prescribing so far. And if you have a look at the total, we've prescribed over 800 interventions so far. And January so far, we've prescribed 228 to date. In terms of the specific interventions, you can see that adult weight management has been the high flyer at the moment, counting for 64.6% of total interventions, and that has been predominantly through Slimming World vouchers, and then closely followed by our stop smoking intervention at the moment, which is our Alan Carr's Easy Way webinars, making up around 14% of the total interventions prescribed to our clients. And you can see a couple of other examples along the bottom of the table where clients may have been signposted to our digital offer. So that's our universal offer through the Feel Good Suffolk website, and other sort of targeted or non-targeted interventions such as the health walks and also leisure centre provision. So these are a couple of general operational updates. So again, we're continuing to accept referrals from professionals via clinical systems, like I said, but professionals can also use the self-referral form on our website. What I would say is if you are using that self-referral form on the website, just to make sure that you're noting down who's referring and which kind of GP practice or healthcare establishment you're referring from. And please also ensure that consent is gained from clients who are referred into Feel Good Suffolk as well. As we've alluded to in the previous webinar, there is further recruitment and training ongoing for our pool of currently 11 Feel Good Suffolk advisors across Suffolk, and they will be undertaking further shadowing, for example, for our stop smoking interventions, and they've undertaken a lot of other training such as behaviour change training as well. There is still a delay between referral and entry into service and contact with our advisors, but this does kind of vary from service to service. But we do expect these delays to hopefully decrease as we develop the services further over the coming months, and like we've said, as further recruitment takes place. Again, similar to last month, we're talking about promoting the service, so please ensure that all posters or promotional materials referring to One Life Suffolk are removed, and you can request up-to-date Feel Good Suffolk promotional materials if needed. And just a gentle reminder, just to ensure that all referral forms submitted to Feel Good Suffolk record sufficient information about the client. So if there's any other relevant medical conditions, support needs, or kind of clearance to undertake certain interventions, we recommend that is also recorded on the referral form as well before submitting.
Okay, so just a quick overview of each of the thematic areas and what's currently going on and what's in development for those services. So as you'll be aware, for our smoker cessation clients at the moment, we're offering out vouchers to Alan Carr's Easy Way webinars to support them to stop smoking through an abstinence-based support mechanism. Currently under development and about to launch is our one-to-one behavioural support plus nicotine replacement therapy service. The NRT itself will be dispensed by pharmacies, and that contract is now live, and pharmacies across Suffolk are actively signing up to that. To date, we've had 34 pharmacies, and we hope to add to that over the coming weeks. Our advisors will then provide one-to-one behavioural support alongside the NRT to support our clients. It does mention there, if you have any questions or want to find out more about the pharmacy contract, there's a contact there for our colleague in public health to ask any more questions. The vape offer we're currently working on is through the government Swap the Stop scheme, and that will enable our advisors to issue vape starter kits to our clients and support them with 12 weeks of vaping to support their quit attempt. We expect that to launch at the end of this month. So along with the NRT and behavioural support, that will add further parts to our service. Each client will be assessed on their way into the service to ensure that they receive the most appropriate support for them.
We are still having ongoing conversations with Community Pharmacy Suffolk and the local medical committee around potential new primary care contracts, and we're hoping that we can continue those conversations. But again, discussions are still in the early stages, but we hope to work with primary care further to develop that offer. And just a couple of points around our smoking cessation interventions and what they currently do not cover. So currently Feel Good Suffolk won't be accepting clients who wish to quit vaping. Our stop smoking service is only accessible to those who would like to quit tobacco. There is information on our website which clients can be signposted to help kind of cut down the amount of nicotine that they're receiving from their vape, but at the moment Feel Good Suffolk won't be able to support those clients. And again, we're not currently facilitating pathways for prescription medications such as Zyban or the newly released cytosine. So clients wishing to access support via those methods should speak to their GP and continue that support within their GP practice.
So onto adult weight management. Currently, we're offering out 12-week Slimming World vouchers to our clients. And then in terms of development, we are busy developing our new group weight management sessions. We expect those to be available over the next few months. There may be some sort of trials taking place initially of those within March time. And then from April, we hope that those will be launched wider. In terms of eligibility criteria, you'll be aware from previous contact that we have now set eligibility criteria for the service. Just to run through that again, so for our tier 2 targeted support, such as Slimming World and group management sessions, A client must be a resident of Suffolk, aged 18 years and over, must be motivated to achieve a healthy weight. And then in terms of BMI, they must be above a 30 BMI or above 27.5 if they're from an ethnic minority group or if they have a comorbidity of obesity. We have no upper limit for referrals into our Tier 2 weight management support. However, if a client is above a 40 BMI or if they're above a 35 BMI and have a comorbidity present, then we will require a professional referral into service. Clients that fall below the 40 BMI or 35 with comorbidity are free to self-refer into our service and can have access to that targeted support. And then in terms of physical activity, at the moment, we have our exercise referral programs on offer, which are delivered by our leisure providers. Clients can be professionally referred into those exercise referral programs. For self-referral for physical activity, we are continuing to support those clients, which may involve signposting into community interventions. We have our wellbeing walks program, which is available to everyone and free to everyone, and various other programs being delivered in the community, which we can signpost to. So that's overall our update for January. In terms of contact, you can go to our website, fieldgoodsuffolk.co.uk, for more support, and there's some FAQs on there. Please also speak to your district and borough lead for this project if you have any questions on the development.
Hi everyone, my name is Harry Shuttleworth and I am a Feel Good Suffolk advisor working for East Suffolk Council. My work with clients begins by taking a referral and creating a case for that on our social prescribing software. This allows me to have all the details in one place, to see any messages from GPs and the other services which refer through to us, as well as record all the interactions that we have with a client. So any texts or emails that we send to them, any phone calls we make. I create case notes when I've had those calls with them, recording any sorts of details that might come up. And we also use the software to manage appointments, to record client goals, as well as any services that they have been prescribed or we've signposted them to. Now, as often as I can, and I'm pleased to say this is increasingly becoming the norm, the next step with a client will be to give them a call. And as Jill Corwin, who is the chair of the Feel Good Suffolk Collaboration Board, said in the last webinar, our vision is to be able to help people at the right time and the right place. And being able to actually have a phone call and have a chat with somebody over the phone just enables us to do that so much more effectively. I started my role in November, and as somebody that likes to learn, I've been really pleased that we've actually had a lot of training since I've started. I came into the role with a background in nutrition and in sports science, but I've also now received a lot of training through my role here in behaviour change techniques. And so when I go into a call with a client, there's, often I'm using things that I've learned about how to build an effective rapport with that person, about, being able to listen and ask the right questions at the right time, and actually being able to find out what it is that they need and how we might be able to support them most effectively. And, very often acknowledging the fact that that person has made that sort of very courageous first step on their health journey. So depending on whether the client's been referred through to us for smoking cessation, for weight management or physical activity, we'll talk about the current offers that we've got. And having spoken to them, I can suggest things that would be in line with the sorts of things they've been telling me. So to give you an example, with smoking cessation, it might be that I find out during the course of a call that somebody's tried to quit multiple times in the past and they've used NRT and for whatever reason it hasn't worked for them. Well, then that means that I know that perhaps something like the cognitive restructuring therapy that we can provide through our partners at Alan Carr might be something that's really effective for that person. It might be that they want to know more about vaping, for example, which is something that we are very nearly having in place through the government Swap to Stop scheme. Or if that client does want to use NRT, I've also now been trained as a level 1 stop smoking practitioner through the NCSCT. And so I will now very shortly be starting to work with clients on a one-to-one basis weekly and be able to sort of support them the entire way through their quit. So that would be, talking to them about, what sort of NRT they might want, how to use it properly, which is often a really big thing, as well as, being there each week to set the quit date, meet with them, and then be there to offer that support or, to congratulate them and provide that accountability, which, supported with some behaviour change techniques to really be able to put them in the best possible position for a positive outcome. And so, yeah, I really enjoy the fact that I'm doing this role. I love it. And, I enjoy the fact that I get to interact with loads of people on a daily basis. I'm always on the phone talking to lovely people everywhere and, being able to help them, which personally for me, I get a great deal of satisfaction about from. So change isn't something that necessarily comes particularly easy. So I think the fact that this service has very much built into it the opportunity for us to be able to support people with behaviour change, even if it's just something small during a triage call or, when we're following up with them, or indeed when we're working with them more closely one-to-one. And, I think that means that people have got a very improved chance of actually making a meaningful change to their health and, their outcomes. So, yeah. That's me, and hopefully I've given you a bit of a better idea of what it is that we do as a Feel Good Suffolk advisor. Thanks very much. Bye-bye.